You know, today is the American Diabetes Association Alert Day, and in recent years, health experts have called the growth of diabetes in this country an epidemic, with about 1.7 million new cases diagnosed every year. Well, in honor of being healthy and aware, we have brought in an expert to talk about diabetes prevention and, of course, how to treat it. So everyone, please help me welcome Dr. James LaValle. Nice to see you.
How are you?
Oh, I'm so wonderful. Thank you so much for coming in. Obviously, so many people are going through this right now as I speak. First, tell us a little bit about the different types of diabetes that we need to be aware of.
Well, there's principally two types of diabetes. One is called type 1. Typically, you get that in childhood or maybe even later in life where you acquire it. And then type 2 is more one of lifestyle, so diet, exercise, but then there's some new risk factors that we're going to talk about too.
Oh, wow. Now, speaking of those risks, who is actually at risk of those type 2 diabetes? You mentioned those lifestyle factors, so is that...
Well, I've got some of those lifestyle factors right here. One of the big things, of course, is if you're overweight, if you're not exercising, if you're not getting enough sleep, if your diet consists of too many carbohydrates, those are all risk factors. 10% of the country now is diabetic, with an estimated 40%, and half of the Hispanic and African American population are predicted to be diabetic in our future.
Wow. Why do you think that this has become such an epidemic, and do you think it's slowing down or do you think it's increasing?
Unfortunately, it's increasing. Look at the obesity statistics, look at the overweight statistics. You know, we're under a lot of stress. We're not sleeping like we should. Big study just came out showing not enough sleep equals obesity and diabetes. And then there's the fact, hidden carbohydrates. It's easy to say, get rid of the big gulp.
I know, it's so hard to, though. That's the thing. And do you think it's up to, you know, more people to make these healthy options available to us? I know a lot of fast food restaurants are trying to create those healthier menu options, but I think a lot of times Americans feel like we just don't have the option. Is that true?
I think that the options are out there. I think you have to learn how to count your carbs. I mean, I know on my website I've got a carb counter for people that they can get. But you have to realize, when you take a bagel in the morning, you're probably getting double the amount of carbs you should be taking in during the day if you're trying to lose weight. So, and then serving size. If you take a look at this, that's a serving of granola. Yeah,
you know, while you talk about that, we're going to bring over Jared.
All right.
So he is a trooper today because he's volunteered to have his blood levels checked real quick. Let's get that checked.
Oh. Who's shaking more, me or you? I'm not sure.
Is he nervous? Is he nervous? It's all right, here we go.
Nothing to be nervous about.
Ooh. All right, how soon can you
get a little bit of blood? Oh, we're going to get it right this second.
You can, all right, what does it say?
I'm bleeding
over here.
We've
got about 30 seconds here.
I give my blood,
sweat,
and tears.
How you doing, Jared? Are you feeling okay?
I'm all right, I'm good.
He's a trooper.
We're going to see what that number shows, and here we go, a 90. Now, if Jared was fasting, a 90 would be right at that borderline where we're worried about, well, what's the future complications going to be? You can think about 1 point over 84 equals 6% risk. Anything over a 90, I start talking to the patient about, well, what do we need to do?
Sure.
But I wasn't fasting, so I'm good, right?
You are good. Good to go.
Thank you so much. We'll be right back here on the Daily Buzz. Thank you.
Great.
Good thing you're good, Jared. Yeah.